It's a good start that already 45 attendees are joined in at the beginning of the conference. Let me briefly introduce the speakers before we go ahead. Let me first introduce Dr. Taha Al-Hasar Mardi, General Manager, Dr. Sulaiman Habib Hospital, and a consultant colorectal surgeon. So he is the great initiative and motivator behind this conference and did a lot of work to make this conference happen. Then next speaker is Dr. Armand F. Abraham, Medical Director, Facelab Aesthetics, London. Our third speaker is Abdulaziz Inga Onyangi, President and CEO, Swift Air Ambulance Services, Nigeria. And fourth speaker, Mr. Usman Iqbal, Director Health Services, Relevance Health Point UK. So as I have shared the agenda with you from the beginning, all of you know the agenda. So I will hand over it to Dr. Taha to start with his presentation.
Assalamu alaikum. I'd like to welcome you all in this webinar. It's a great pleasure to have you all and also the honored guest speakers. We'd like to discuss the situation of the medical tourism post-COVID. As you are aware, recently we are declared as a COVID-free hospital after managing 1,642 patients with the highest recovery rates, 99.6%. We thank God for this blessing that we don't have any COVID patient anymore in our hospital. And the whole COVID crisis is going to fade away soon in Dubai. So I welcome you all, and let me just put some lights on the possibility of medical tourism with Sulaiman Al Habib. Sulaiman Al Habib Hospital is a tertiary level care hospital. We have all the specialties, almost all the specialties. We are doing everything except transplantation and management of burn. Otherwise, we do all type of medical services. We do open heart surgery, we do interventional cardiology, we do knee replacement, we do joint replacement, advanced spine, advanced epilepsy surgery, advanced brain surgery, bariatric surgery, endocrine surgery, hepatobiliary, beside medical and pediatric and subspecialty. So we are running a wide scope of services here, and it's on a tertiary level care. Broadly speaking, we have 98 consultants. 100% of them are Western qualified. They are between 48 American board certified, and the rest between Canadian board certified, UK trained, CCST, and Germany and France. And the inpatient is covered by a specialist. We have 56 specialists covering all the specialties for the inpatient, managing and caring under the supervision of a consultant for post-operative care. And also we have a home care visit. So we are doing some continuity of care program for our patients. So recently we launched something called Al Habib Life Care, which is a telemedicine approach. We start receiving some medical consultations from different parts of the world. I think this will make the life easy for the medical tourism. So the patient, the referring body can share all the medical documentation through Habib Life Care with the doctor. And the doctor can talk to the patient in his country to discuss the options of treatment, to discuss the possibilities, the outcome of treatment. So it becomes easy. Just log in and take appointment, and the doctor will look into the lab test and all the radiology findings, probably to chat with the patients. This makes the medical tourism easier, not necessarily patient to transfer to travel to reach to destination and then we can search for a doctor. We can provide this at Habib Life Care, which is a revolutionary approach whereby the patient's file can be seen and it can be always approached through the clinic of the doctor. We are intending to capitalize on this because we have a lot of customers all over the world starting sending and asking for a second opinion. We need to capitalize on this in our future medical tourism adventure by creating some sort of referral centers where the referral center can use this facility of Habib Life Care in order to discuss the option of treatment. It can be also between doctor to doctor discussion, doctor to patient discussion, doctor to family discussion. So it's very well structured program, and it can facilitate the travel of the patient to the destination that he is looking for, whether here in Dubai or in our branches in Saudi Arabia. As far as the medical tourism, we are looking forward after the launching of the tourism back in Dubai after July 7. We start receiving people traveling for tourism purposes in Dubai. The procedure in the airport is easy. Now everybody coming through the airport, swab taken, and the lab result released within 12 to 18 hours, maximum 24 hours. By the time he is checking in the hotel, on the second day he will get the lab results. Of course, he will be allowed to leave the hotel after 1 day if he is negative. Also now Emirates Airline is launching a service with some countries to do the corona test at their country in a very identified lab. And then this procedure will not be followed, as they are going to do it 3 days before travel. So the travel, yes, becomes a little bit complicated, but it just can retain back the business back. Our hospital is fully equipped with the modern technology. As you can see that Sulaiman Habib is focusing on cutting edge in technology, and we can we proved that this technology helped a lot in managing COVID patients. As just to give you an example, we have 38 intubated patients during the COVID era from March till end of June, and thank God, alhamdulillah, the recovery rate was very high. Only we have 5 deaths out of 38 ventilated patients. Most of them recovered and went home safe and sound. So we are looking forward to welcome any referral from different countries, and we are capitalizing on our technology in order to facilitate the journey to cure. I call it journey to cure, as the medical tourism is aiming to provide the medical care to different people across the globe with a reasonable price, affordable price, and at the same time with a good clinical outcome. And I think we are able to afford a very good clinical outcome. So just to give you example, last year census, we have more than 11,000 patient admission, and we have done more than 5,000 surgery, and alhamdulillah, the complication rate is below 1%. The return to OR is less than 1%. Mortality rate, we have less than 1%. Our ICU was chosen one of the best ICU for one reason, because it's managed all by specialized doctors, and also it's connected by tele-ICU with our headquarters in Saudi Arabia in Riyadh, where all the patients are monitored by consultants ICU from the command center. And every day there was discussion about the patient's treatment, or the modification of treatment. So I'm proudly speaking that we are a pioneer in using the telemedicine, as we have very well structured tele-ICU which is really commendable. Our headquarters in Saudi Arabia is not managing only Dubai, 7 hospitals, plus more than 35 district hospitals in Saudi Arabia is connected to this command center. So medical tourism becomes easier. We can communicate, we can arrange, we can plan the treatment, and also we discuss the option of treatment even before the travel of patient to Dubai to make the journey to cure easy and feasible. Do I have more time? So I have 2 minutes more. Just to also comment on the diagnostic technology we have. We have 2 MRIs and 2 CT scan, state of the art. And we have also interventional radiology. We do interventional spine radiology. We have interventional neurospinal radiologists who do management of disc through a keyhole by doing laser discectomy, by doing some sort of ablation of the nerve ablations for those with the chronic pain. So we are proudly have done more than 10,000 radiology procedure in our hospital for pain management. We also have a very good approach now doing stem cells. Now we are approaching to use stem cells in the treatment of certain chronic diseases. And I have a team who are pioneering this under supervision of DHCC. We are using stem cells now in gynecology, and also we are using gynecosmetics, also can be used for renovation of the and retention of sexual life for the ladies. We have wide scope of service for the also for men. We are doing this kind of services also. So to conclude, Sulaiman Habib is unique. It's a part of big family. We are more than 8 hospitals, big hospitals in Saudi Arabia and Dubai and Bahrain. And we are running a very high advanced technology. And we are managing daily through the group, whether here in Saudi Arabia, more than 10,000 patients per day. Thank you so much for giving me this opportunity, Dr. George. Thanks for everybody for listening, and I'm ready for any question. Thank you.
Dr. Taha, I have a question. What kind of treatment medical tourists are looking in Sulaiman Habib? What are the specific surgeries you offer?
So we can offer two type of surgeries. To say it in short, we name it, find it. Open heart surgery, we do open heart surgery. We do interventional complex cardiac procedure, like an intracardiac pacemaker. We do difficult stenting. We do some sort of angioplasties in the heart. Peripheral angioplasties we do. We have a very good vascular surgeon who do peripheral angioplasties for those with ischemia, especially for diabetic patients. We do thoracic surgery, we do brain surgery. We have a professor of neurosurgery here who is doing and capable of doing all type of brain surgeries. And also we do advanced spine surgery. We do kyphoscoliosis correction. We have Dr. Ilyas Rahal, who is expert in kyphoscoliosis. Also we have, and we have done it before, we do epilepsy surgery. And to give you a brief, we have done more than 135 epilepsy surgery with a very high outcome, around 92% recovery rate from epilepsy, especially for children. As we bring the children into monitoring unit in the 24-hour monitoring unit for the epilepsy, we can localize the focus of epilepsy and we can remove it from the brain. We are the first pioneers in the private sector in doing awake surgery. We are patients awake while we fix the epilepsy. Also, we do some sort of facial bone reconstructions for those with tumors and devastated road traffic accidents through our neurosurgery, orbit surgeons. So if I can start counting, I will never stop. We can do all type of specialties, surgeries. We are ready to do it, and we are planning.
Dr. Taha, thank you so much for this opening the topic in such a nice way. Thank you so much. We will move to the next speaker, Dr. Armand F. Abraham. Can you unmute yourself and switch on the video?
Good afternoon and hello everyone. My name is Dr. Armand Abraham, and I will be talking about the precautions for medical air travel during the COVID-19. I will start by the WHO recommendations for international travel. It is to avoid unnecessary travel to affected areas around the globe. It is also for travelers who are sick to delay or avoid travelers and people with chronic diseases or underlying health conditions. Having said that, it is important to clarify that the WHO recommendations for international traffic is advising against the application of travel or trade restrictions to countries experiencing COVID-19 outbreaks. In general, the evidence shows that restricting movement of people and goods during public health emergencies is ineffective prevention from other interventions. Furthermore, restrictions may interrupt needed aid and technical support, may disrupt businesses, and may have a negative social and economic effect on affected countries. However, in certain circumstances, measures that restrict movement of people may prove temporarily useful. It is important to stress that the WHO advice does not apply to essential medical travel. Now, what is essential medical travel? Basically, urgent travel to save a patient's life or to control and treat a fatal disease where local treatment is not available and or ineffective. Now, what is the current international travel advice in the UK and similarly in many countries nowadays? The Foreign and Common Health Office currently advises British nationals against all but essential international travel, and the essential international travel includes medical travel. So that is an exempt. There is also a list of countries exempt from this advice, and this advice is being under constant review. Travel disruptions is still possible, and national control measures may be brought in within very little notice. Now, if you decide to travel or to medical travel, how to help control the COVID-19 spread prior to air travel? It is by avoiding busiest times and routes, keeping your distance when you travel 2 meters apart where possible, washing or hand sanitizing hands regularly, and abstaining from travel if you are experiencing any coronavirus symptoms or have experienced in the last 7 days. If you are abstain from travel as well, if you are self-isolating as a result of coronavirus symptoms, if you have been reached or instructed by the healthcare authorities to self-isolate through contact tracing, if you are in a household where someone in your household has experienced coronavirus symptoms within the last 14 days. Now, before planning or booking international travel, you should do all of the following. Check your foreign ministry or foreign office for country-specific travel advisory notice regarding travel and entry restrictions. Review the local medical care available at your destination. Check for details of your risk of exposure to coronavirus symptoms in each country. Check if you are at an increased risk of COVID-19 or among a vulnerable group. A very important one is getting a travel insurance. It's very essential. Also, if you have a travel insurance already, it is important to check the validity of your current travel insurance, as most travel insurances do not cover pandemics. and they also do not cover trips taking place against government travel advice. Consider physical distance and hygiene measures. Check both your outbound and inbound journeys for self-isolation or quarantine rules you must follow upon your return. Try to follow paperless and online checking where possible. Avoid walking around the airport unnecessarily or shopping. And definitely follow the airline and airport guidance for social distancing. Now, many may be concerned about an infection on board a flight, given that it may be crowded or overcrowded. So the question is how safe it is to air travel in a modern cabin. In fact, it is very safe. The European Aviation Safety Agency has commissioned 2 studies with aim to gain solid scientific knowledge about cabin air quality on board. These studies showed that the cabin air quality is similar or better than what is observed in normal indoor environments, such as offices, schools, and home dwellings. Modern aircrafts have high efficiency air filters, very similar to those used in hospital operating rooms. They capture more than 99.9% of air microbes in the filtered air. Now, what are the medical conditions that should be cleared for fitness to fly prior to traveling during a pandemic? There is a list, a general list, but let's stress on these conditions: cardiovascular diseases, uncontrolled diabetes, pregnancy, and absolutely the pulmonary diseases, and some surgical conditions, especially post-organ transplant, where your immunity could be compromised after the surgery. Now, how to decide the best medical destination during a pandemic? And the question is whether to stay local or to travel overseas or even stay regional. This decision-making will depend on certain factors, some of which would be how critical is the case, availability of treatment, the availability of the treatment locally or regionally, fitness to fly during a pandemic, costs of medical travel during a pandemic, as it may very much be different to normal traveling in terms of accommodation, in terms of if you have to self-isolate for 14 days upon arrival to your destination, which could be very much costly. You should also check the local travel advice and restrictions, checking also the destination of choice and its travel restrictions, local and international quarantine measures, and quarantine measures and travel insurance available for medical companions if applicable, and absolutely for personal patient companions, as most patients will not travel alone. They will be having companions with them on this trip who are not ill and do not require medical treatment. So we need to ensure that they are covered by a travel insurance, and we need to ensure that they're also able to companion the patient to the hospital or to be around the patient in the medical travel destination. And what are the measures in this country, in the hosting country? Now, finally, I will be talking about some of the factors influencing the decision-making regarding choice of patient air travel between a stretcher case or an air ambulance case. It will depend on how urgent is the case, fitness to fly during a pandemic, and stretcher flights availability and schedules, as most flights most airlines have experienced disruption, extreme disruption during the past period, and they are emerging out of this right now. And not every flight has a stretcher. So checking how urgent is the case and how compatible it is with the available or the scheduled stretcher flights, and also costs. And you need to compare all of this to an air ambulance cost. Finally, I would just mention one thing regarding the process of travel in the airport. Most airports now have different procedures and different process for traveling in terms of pre-boarding and boarding and arrival. It will be very difficult to generalize what are the measures in all airports. So it's very important to check your route prior to booking and follow the guidance at each airport or destination of your journey. And thank you very much. And I'll now move to taking questions.
Dr. Armand, thank you so much. We will take your questions towards the end of the session. So we will move to the next speaker, Dr. Abdulaziz Ingoniyangi. He is the CEO of Swift Air Ambulance. He will be talking on a Nigerian perspective of medical tourism.
Okay, Assalamu alaikum, everyone. Good afternoon, good evening in Dubai, good afternoon, Nigeria. Thank you, Dr. Sulaiman Al-Habib, for inviting me to speak on this topic, medical tourism challenges, opportunities, post-COVID-19 Nigerian perspective. As we all know, Nigeria, as Africa's largest economy, with Nigeria being one of the largest economy with a population of close to 200 million. Nigeria is critical to the COVID-19 response in the region. 1 in 5 sub-Saharan Africans are Nigerians, and the economic and social impacts of the COVID-19 in the country will have a major ripple effects across the continent. With government revenues collapsing, following the fall in oil prices, mitigating the health emergency and subsequent economic ramifications from COVID-19 will be an unprecedented challenge for Nigeria's policymakers. Fatalities from COVID-19 in Nigeria are currently relatively low in the global context, with about, as of today, at 1,323 active cases. However, the federal government has warned that up to 4 million people, could be affected after 6 months if social distancing measures are not well implemented and observed. This high burden of infectious disease is likely to put extra strain on an already underfunded health care sector. Medical tourism leading to a weak healthcare system. Wealthy Nigerians have often preferred traveling abroad for medical treatment. The Minister of Health at a point in time estimating that the country spends over $1 billion annually on medical tourism. But with borders shutting around the world, Nigerians' elites must now confront using their country's own healthcare facilities in battling COVID-19. They will be concerned by what they see. It's really, really bad. Latest data from Africa's 10 largest economies show that only Ethiopia has fewer hospital beds per capita than Nigeria. The most recent WHO data puts the number of hospital beds at only 5 persons, at 5 beds per 10,000 people in Nigeria. This low overall spending makes the healthcare system particularly fragile and at major risk of being overwhelmed. Without additional funding, demand for healthcare services, especially critical care services, will significantly exceed capacity. This is likely to have long-term consequences for the health sector, as well as spillover effects to the rest of the economy, vis-a-vis loss of workforce, productivity losses, and so on. Well, despite several reports and commentaries drawing the attention of our duty bearers to the decay in the health sector before the current virus pandemic, no attention was paid after all. And now, the consequences of executive negligence are here with all of us. Some of the pre-COVID-19 editorials and headlines usually sounded like equip Nigeria hospitals like UK, NMA and unbridled doctors, exodus, Africa's public service and health sector drain. Because oftentimes Nigerian doctors seek jobs abroad. It is a shame because our leaders fail to read the writing on the wall because they could easily fly to other countries for their healthcare. This is unwarranted self-centeredness, and COVID-19 challenge has become the algorithm. The borderless COVID-19 pandemic, which is an equal opportunity killer, has brought to the fore the effect of the age-long neglect of the healthcare sector in Nigeria. As a matter of fact, the COVID-19 pandemic is an experience that is and will be the best teacher for our leaders and high net worth individuals because of no sick political office holder or public office holder can be flown abroad for healthcare for obvious reasons. The lockdown, the global context. And that's why even in the aircraft charter services, we've not been able to move because of the global lockdown. With the lockdown, sick Nigerian elites and public officers are trapped in their power and wealth to the extent that they have stopped solo. They have stooped solo. The big men and women never knew that one day Nigerians could never travel abroad for 1 week and the world will be shut down by one virus. Currently, all international airports are closed. They're just beginning to reopen with rules and regulations, as we've heard from other speakers. And the health systems of developed countries have been overstretched. Their safe havens are overwhelmed by the healthcare needs of their citizens and migrants occasioned by COVID-19 because of some of them are now the worst hit countries like United States of America, India, and UK. Now, what are the opportunities? Opportunities that will arise in medical tourism. While the COVID-19 pandemic has strained the healthcare system, not only in Nigeria, but worldwide, another challenge that is around the corner is how will the healthcare models evolve once the lockdown is lifted? There is no way hospitals can go back to functioning how they used to, no way. A lot of changes will have to happen on the administrative and clinical level to adapt to the paradigm shift that this pandemic has created. In the short term, the immediate action for which healthcare experts and organizations should be prepared for is the possibility in spurt of COVID-19 cases in areas that have partially lifted the lockdown like Dubai, which may or may not lead to reversing the situation to complete lockdown again. Additionally, once the lockdown is lifted, there might be an increase in patient flow, especially from underfunded healthcare system, especially people who have elective surgeries planned, like oncology cases, orthopedic cases, neurology cases, and these have been pending for over 2 months now. Now, ensuring timely treatment and complete patient safety is going to play an important role in restoring the trust of people in visiting hospitals, even abroad, who have, due to COVID-19 fear, refrained from going to hospitals abroad. Since getting a COVID-19 test done has become mandatory for a patient who is going for admission in the hospital, administrations need to ensure ease of admission, especially for patients who are undergoing regular treatments like dialysis and chemotherapy. Now, telemedicine, encouraging telemedicine, like the first speaker mentioned, teleconsultations, to ensure there are no heavy crowds in the hospitals leading to the transmission of any virus to a large gathering is important. Video consultations, teleconsultations have been helpful for patients, and this can be continued even after the lockdown is lifted. And it should be on the health professional's discretion whether a patient needs to needs to have a face-to-face physical examination, or it can be consulted over radio or audio call. Decline in medical tourism due to the pandemic. Medical tourism has been an especially important aspect in terms of generating revenue for the sector. But due to COVID-19, it is said to see a downtrend, at least in the short term. Therefore, filling that revenue gap by preparing a parallel plan for medical tourism is very, very crucial. However, the COVID-19 pandemic has further exposed the crisis in the Nigerian health sector, even as medical doctors battle to curtail spread and treat the infected. Every well-meaning patriotic Nigerian with a conscious and progressive mind would have realized that the advocacy on the need for government at all levels to prioritize the health of the people and investments in the health sector have become glaring with the challenge of COVID-19. Accordingly, people now understand that what it means to say health is wealth. I do not therefore think that anybody needs any other lesson apart from the learning point from the current challenge. To know that going forward, health has to be priority in terms of investment decisions of government at all levels and even decisions of all of us as Nigerians. Now, reasons why medical tourism outbound will continue to thrive in Nigeria. People will continue to move out, to seek for proper medical care. Speaking of banning foreign medical trips, some factors should be considered. One, supposing somebody has his own money, you cannot stop him because that would be a breach of his human rights. You can't say you won't sponsor him with government money. You can say you won't sponsor him with government money because government has the right to how it wants to use its money for the betterment of the nation. But if a person has his own money, you can't ban him from going abroad. That is totally against his human right, and the human rights, number one, is right to life. Number two, what we should do, ask ourselves, is how do we now first build a viable health system before banning those who are being sponsored abroad? Or do we put the ban in now to say, damn it, anything happens to such public official while the ban is on, well, too bad. Most importantly, one should consider a situation as in the past where the head of state, vice president, or a governor was seriously here and the country allegedly did not have the facilities. Do we say he should die here because we have a principle that no medical tourism for health purposes? Do we allow such to happen to a major person whose health will shake the nation? Three, the healthcare continues to be very weak. Nothing has shown there's hope in turning around the clock, despite the opportunity and the advantages. And taking advantage the pandemic has created, there is no new normal in this context in the country, but old normal. So medical tourism will continue to thrive. A lot of specialties can still not be effectively managed in Nigeria, and a window of open skies and safe destination points will see an influx of massive medical tourists. In conclusion, I think we must put hands together and vigorously transform our health system. But until we do that, I don't think medical tourism will be on the decline. In fact, it's going to be on a sharp rise because we have quite a number of patients waiting for the opportunity to travel. The COVID-19 is like no other. It has exposed flaws in the response of governments all over the world to healthcare and social security in both the developed and developing world alike. Nigeria is therefore not unique in facing difficulties. In any case, medical tourism outbound will continue to thrive as most Nigerians are already on the lookout for international airspace to be opened to enable them seek for quality medical care. Destination hospitals, we need to embrace a new model for patients' comfort. Teleconsultation will play a new role in the new normal, largely to be done in collaboration with referral agencies like Swift Air Ambulance Services. Another option would be a monthly organized second opinion consultation for visiting doctors in various specialties. Thank you very much. I'd like to take your questions, if you have any.
Hello, Mr. Onyangi. Thank you so much for your very knowledgeable insights on the Nigerian healthcare. I think we have already around 100 participants to join on a Sunday afternoon. It's a huge number. So I understand the importance of topics, so all the participants are joined in. Now, before we take questions, we go to the next speaker and we will take the questions in the last. Our next speaker is Mr. Usman Iqbal. He is Director of Health Services Relevance Point Health UK. Yeah, we can hear you.
Hello. Yes. Hello, everyone. Good afternoon and good evening to all our participants in Dubai, apparently. Um, as you know, that primarily UK is now in a very difficult sort of a situation we are going through, because few of the areas which apparently were cleared from COVID-19, we are returning back with a smart sort of a lockdown. Especially people who have joined me from UK, they would know areas in outskirts outside from London, especially Leicester, was put into a lockdown last week. So situation is it's quite mixed, and I would say it all depends upon whether the government strategy to cope with this kind of situation is it's quite clear, or it has got some ambiguity. And I believe that it's been quite a while since we started this lockdown. I think we started on the 22nd of March, and coming down till today, uh, we have not yet started a complete business life within UK. In this situation, I believe we need to have a post-COVID marketing strategy for international medical tourism. And when I was approached by Dr. George Davis, I think the idea was that to give enough confidence to all those patients who want to travel outside from UK and want to come in, because as you imagine that within the Europe, I think we have got the highest mortality rate, but at the same time I think UK came out from this scenario quite it was quite impressive that keeping in view the amount of cases which we received and the way the national health services have basically managed this such a high challenging task. I believe it's hats off to them. Secondly, I think it's more like a case where the more pragmatic media articles predict that like other flu, diseases like flu, health, or political crisis, COVID-19 will pass. I think it's matter of time. When it will pass, we have to see how much effects does it leave on the economy, and especially on international medical tourism. Well, some physicians believe that it will peak soon, then decrease during the summertime, especially when you talk about countries like GCC. But there is not an authentic, or there is not concrete evidence to the fact that temperatures will have an impact on spreading the virus. But in an overall context, I would say that we still have to make up our mind. We still have to see that entities like Sulaiman Habib, who pretty much have got an edge on delivering cutting edge technology services along with the medical treatment which they perform. I believe this will open up a lot of opportunities for all of us. And the benefit from this economic meltdown would be, to attract the international travelers as tourism picks up again, and the flights and accommodation costs may vary because it will be very competitive. Because everybody will be coming out from their den, and they will try their level best to achieve the maximum revenues. Treatment cost will possibly follow along with the other related services in medical travel. The first medical travelers after COVID-19 are likely to enjoy their treatment journey at a very affordable prices and with no waiting times at all. Although within public sector in England and in Wales and in Scotland overall, I think we will be hitting a waiting list of 10 million, but that is totally public side. But if you talk about the private sector, I think I have been engaged with the private industry for over a long period of time, and I regularly meet people. Last week I attended one of the conference with the British Arab Chambers of Commerce, and this was one of the agendas of the meeting. That what are the opportunities available, especially for the health industries. And at the same time, I think the second and the second important element would be the research and development, because the established medical travel destinations whose governments and health bodies have managed to contain COVID-19, maybe even they have been considered as safer countries for patients for looking for health services. And medical travel providers in these countries who have survived COVID panic are the ones who are likely to enjoy the fruits of the post-COVID era. So I believe, again, it's about setting up state-of-the-art facilities for this pandemic, and then coming out, going back for the post-COVID situation, going back to the new normal, which doctor said already. So, and the third would be the shouting about the accreditation and the governance model of the pandemic crisis. And I believe it's very important when Sulaiman Habib they pitch up that they are now COVID-free hospital, which means that for readers and I personally know a lot of patients and the doctors, it was quite a thing that which needs to be praised, because if you are 100% COVID free facility, which means that it encourages a lot of patients to walk in through your doors, and which is very helpful. So it's all about shouting about accreditation, and lessons from the COVID-19 are an opportunity for accreditation companies, I would say. And healthcare quality assurance is now an even hotter topic. And so far, many hospitals with certifications from high quality accreditation companies have been well prepared to handle the crisis. So a line of protocol that was applied to the hospitals, and mainly I'm talking about the private sector, has played a significant role in identifying this virus early. So protecting the rest of the hospital patients with other hospitals, maybe COVID-19 will be the motivation for providers to improve and become safer for the patients. And the lastly, I think, which has got a direct impact on your medical tourism, will be the quarantine strategy. And as you know, every country has got their own strategy to meet such a challenge. And I believe when it comes to UK, today, as of we are talking, I think UK has already published a list of 75 countries which are exempt from the quarantine rules. So which means that over the number of maybe next 2 or 3 weeks, we'll see a continuous increase in the exemption list. But it all also will depend upon that, what are the number of cases which have been reported into those respective countries. But I would say that, people or the patients, especially who wants to travel down from GCC, from Middle East, or even from Africa, I think we all know that, UK becomes one of the hub for all the patient destination, and seeking the medical treatment. But I think it's a high time, and I was there last year. I had few meetings with a couple of delegates, especially the surgeons, and also I met Dr. George Davis at his facility. I believe it's a high time that we start working on the patient referral system, because ultimately cost will play a vital role. After all, these people have got job losses, companies are going for downsizing. So I believe this will all have an impact on medical tourism, and one needs to think strategically that we need to work more smartly, how we should go towards more strategic alliances, talking with each other, and see how we can manage our patients. And I think that would be the best way move forward. And these are the few deciding factors which will determine what strategy is the best for upcoming days. And if you have got any questions, I'm more than happy to answer.
Thank you, Dr. Thank you, Mr. Usman. Very insightful presentation on the topic. So we are almost like now 90 participants who have joined in. So now we have received around 10 questions for different speakers. So I will take one by one. So we will have the Q&A session to be finished in next 7 or 8 minutes. So we can be in timeline for the whole session. So the first question is for Dr. Taha. So, so the question that is asking is, how does the gap in the patient flow in the last 4 months, and how we are managing the waiting list of inpatients and outpatients? This is from Mr. Abdullah from Nigeria.
Yeah, that's very good question. To answer this, first of all, we have been affected by the lockdown and isolation by the Dubai government. Yet during the lockdown, we managed the volume of patients teleconsultation. So our work was focused on getting the patients logged in through a proper and effective teleconsultation. We even delivered vaccines to the children at home, and also we delivered medicine to the people there. So this kind of communication and using the technology to overcome the obstacles that happened because of the lockdown, we managed to keep our track on the patients at that time. Post-COVID, yes, we have we used to have a long backlog of surgeries. We scheduled them and we try to accommodate them according to the capacity. Don't forget that we went through the COVID-free status gradually. So we didn't reach the COVID-free status overnight. It takes us around 1 month to clear the house from the COVID patients by either they are recovered and sent home or by shifting them to government facility. So it takes us 1 month. After that, there was an inspection, and then we start to accommodate patients again. So yes, there is a gap in the volume of patients, but using the technology was helping a lot to narrow the gap, and also effective planning, especially if you keep in consideration that travel limitation was helping us during the summer. Usually in Dubai, in summer, there is the business goes down, and you call it seasonal impact of the people traveling outside during the holiday. But it comes into our benefit, it seems, that the people traveling outside is limited, so we start having a good trend of inpatient. Takes us around, it will take us around 1 month to cover the backlog. Yet we have also new patients coming. It seems that end of August we will be bridging the gap to start the new season, especially if you know that Dubai is going for travel, and also schools will be back in September, because the number of cases start to go down, and also most of the cases reported are very mild cases. Hopefully by this time the world will reach to a vaccine, so inshallah we will be ready to recap back to the normal track of business. We are proud that we are covered the 3 hospitals and we are ready to receive any patients.
One more question for Dr. Taha. It is from Barakat Yakubu, asking what are the facilities in Dr. Sulaiman Habib Hospital for the medical tourists?
Well, first of all, we have an agreement with hotels nearby the hospital, so we can recommend those hotels and they can use the prices that really reasonable for Sulaiman Habib patients. We have agreement with Novotel, which is only footstep from the hospital, whereby the family can stay there, or a companion can stay there. Although if there is surgery, we are also providing extra bed for the companion to stay with the patient in the room. The facility is ready in terms of doctors, staffing, and also the medical and equipment and consumables. We have facilitated this, but I'm just focusing on the Al Habib Life Care, which is a telephone or telemedicine. So before travel, patients can review his case with his treating doctor, and they can agree on the treatment plan. So once the patient travel, there will be no delay to take the patient to the definitive care. So using this technology will enable the doctor to know more about the patients and also to make up the proper clinical solution for his dilemma. And if the patient agreed and travel, then this will make it easy for him to come directly to the hospital without further delay to repeat investigations or to do some sort of more investigation, because most of this can be sorted out through Al Habib Life Care application.
Thank you so much, Dr. Taha, for the inputs on this topic. The next question is for Dr. Armand Abraham. Can you mute yourself?
Hello.
Yeah, this is from Oman. The question is for the medical travelers. Earlier there used to be a fit to fly. How there will be any change in this fit to fly document as of now, or it will be the same?
No, there is a general fitness to fly list of conditions that must be. Can you hear me well?
Yes, yes, we are hearing you.
Yeah, so there is a list of conditions generally that needs to be cleared for fitness to fly. But what we are saying is that during the COVID-19 pandemic, let's look at it this way: the most vulnerable cases or most vulnerable groups with certain underlying health conditions, they are to stress that's to stress on their fitness to fly even more. Because then if they are not fit, if they are not fit to fly on a stretcher case, on a stretcher flight, as a stretcher case on a flight, on a commercial flight, then you will be faced with the option that you need, because this case is critical and urgent, life-saving. You would be faced with the option, with the costly option of having to choose an air ambulance, depending also on the destination, as well as the availability of the flights, and has resumed stretcher on commercial flights. Does this make sense?
Of course it does.
Yeah. So this is what I'm trying to say. It's just the.
Thank you so much, Dr. Armand. I think there will be some clarity about the whole situation once we move forward, because until now, all the airlines, they don't have a clarity on how is the medical travel going to be. It will take some more time so that it will be normal. So next question we have is for Mr. Onyangi. So the question is for regarding the patients traveling from Nigeria. What will be the top 2 challenges what they have post-COVID?
Well, number one, I think for us in medical travels, one of the first challenges we've been facing is, number one, availability of flights. Now, one, two, they need to always have a COVID-19 certification, at least for us, 48 hours prior to your journey. You know, it's very, very, very important. It's a huge challenge. Now, and whether we like it or not, you know, I mean, this will continue to happen. Now, as it is in the aviation industry right now, getting medical charter travel, it's pretty difficult. You know, so if you have any need to really travel right now, then it's always better to be proactive, you know, and get all the logistics, the paperwork done, over here spaces, and so on and so forth. So for us, I mean, this is the short answer I can have to that. I don't know if that makes sense.
Perfect.
Yes, Dr. Onyangi. And also one more thing is that for the COVID testing of the patients, and this one is affecting the patients, like for the COVID screening.
Mm-hmm. Sorry, take that again.
My question is, some of the airlines, they are asking for a mandatory COVID test before the flight. Is the rule also applicable in Nigeria, or still they are negotiating on this one? And when do you
No, no,
expect the
no.
airport will open?
Okay, no, they are accredited, molecular centers for COVID-19, authorized by the federal government. And I could see that even Emirates Airlines for commercial travels actually brought out a list of the various centers in Nigeria that PCR can be accepted. Now, for the international airspace, I guess very soon, I think one step at a time, because it tend to be tacky sometimes. So we need to first see how the local travel goes, the spacing, the cost of travels. So for us, yes, definitely. I think very soon the international airspace will be open, and we have quite a number of molecular centers accredited,
Thank you, Dr. Onyanki. And we have a couple of questions for Mr. Usman. So for marketing medical tourism, according to your experience, which all channels will be more suitable after COVID?
Yes. Can you hear me now?
Yeah, we can hear you.
Okay. Dr. George, do you mind if you can repeat your question, because I couldn't hear you properly?
So my question is, this is one of the attendees, participant delegate. He asking, previously before post-COVID, mostly the marketing was through social media. Do
Yeah.
we have to have any changes in the strategy, or the similar strategy can be applied post-COVID as well?
I think everything has pretty much changed in wake of COVID-19. And when you talk about health tourism marketing strategy right now in post-COVID situation, it will primarily going to change. Although social media is an awareness, you can run an awareness campaign. But as I've mentioned in my earlier speech as well, that you need to talk, you need to shout more about your facility. And the way Dr. Taha has quite clearly mentioned that the hospital is quite ready for welcoming any kind of a patient, whether they have got underlying health conditions or not, or it's purely mandatory for COVID-19. But I think accreditations, your patient flow modeling, and then also talk about that how you have coped with this situation, because it has been a litmus test for pretty much a lot of patients and a lot of people around the globe. They have seen that which facility has managed it well. And when we say that is my facility for this special specialty or this specific disease, I believe that's the best way to move forward. But also there's one more thing which I would always encourage people, that you try to establish more direct contacts, the way Dr. Taha mentioned about tele health. I believe these are the few things which you can just clarify. Being a patient's perspective, I think it's quite good. And when you do want to do a marketing, of course, definitely you will always highlight that our facility is like COVID free, and we were the first ones who came out from this pandemic. We have an additional trainings given to our staff, although you have got doctors, nurses, and physicians, or your nurse practitioners. But apparently it's all about how you shout about it, how you tell, and how you basically communicate with the people. So I think marketing has changed. I think the factors influencing the strategy will change, definitely.
Mm-hmm. Yeah.
Usman. So I think we will wind up the session. Thank you for all the great speakers who has joined us and given their valuable input. Thank you so much, Dr. Taha, for taking the initiative to have this conference organized. And he has took all the responsibility to organize in such a way that all the participants know about it and take it forward. Thank you for the three great speakers, Dr. Armand, Mr. Onyangi, Mr. Usman, who gave his input. So we have around 100 participants attended this conference. They show that how much people are interested in this topic and how much enthusiasm people have in this conference. So With this thing, we will brief with a small video which we have done with the Emirates Airlines.
Hello, my name is Dr. Taha Hazamerdi. I am the General Manager of Dr. Sulaiman Al Habib Hospital in Dubai. I advise you to drink plenty of fluid and move around during long flights to avoid unnecessary medical problems. I wish you a pleasant flight with Emirates Airline and welcoming you in our facility at Dr. Sulaiman Al Habib Hospital if you need any medical help.